An Edmonton doctor has invented technology that could prevent thousands of hip replacements in Canada every year. And it all starts with screening babies. Su-Ling Goh joins us now with more. And Su-Ling, this is very cool.
It is, yeah, and they're calling this the 21st century stethoscope. Pretty neat way to put it. Every day in Alberta, about 4 babies are born with hip dysplasia. Many go on to develop arthritis, eventually needing hip replacements. But a local doctor has teamed up with experts in AI for a tool that can prevent a lifetime of pain.
Tamara Stab had a hip replacement at age 40. Now at 50, she needs the other one replaced. It's all because she was born with dislocated hips.
I have a pretty high pain threshold, and I think that's because I've been in pain all my life. I'm used to it.
But that pain never had to start. If Tamara would have had an ultrasound as an infant, a doctor could have discovered her hip dysplasia and fixed it with a brace.
So if you can see it as a baby, then you can treat it and it goes away.
Dr. Jacob Jaremko says in Canada, only babies with a family history of hip dysplasia or those who are born breech are tested. There is no universal screening program because of the cost.
Having a radiologist read every baby's ultrasound would be much too expensive. It's too complicated. You need an expert scanner, an expert interpreter.
That's why this radiologist and biomedical engineer helped develop a high-tech tool.
Press the magic button, and we'll see what the computer thinks.
MEDO.ai can turn a 2D ultrasound image into 3D, then flag potential deformities.
That it's predicting this is a dysplastic hip and has a high confidence in that.
He says someone with a few hours of training could scan a baby's hip, then the computer can analyze the image.
So my role as a radiologist is perhaps a little threatened by that because that's what I do.
Of course, a radiologist would still need to confirm the diagnosis, but the MEDOai team has shown the software is just as accurate as the traditional system, and if it's merged with a portable ultrasound machine, it could be used in rural or remote areas.
Yeah, my life could have been much different.
Because Tamara's body has been compensating for bad hips for years, she also has knee and wrist issues, problems she hopes can be prevented in the next generation.
Why would you not support that?
The team hopes to have MEDOai ready for market within 18 months and in use throughout Alberta within 5 years. They say it could also eventually be used to diagnose thyroid cancer. So it just gets cooler and cooler. Some really amazing technology coming out of Edmonton these days.
It really is. Just keeps getting better.
Yeah.
All right. Thanks, Su-Ling.
Thank you.